Hi, everyone. We're going to start in just a few minutes, so please take your seats so we can get started on time. Thank you.
Hi, everyone. Thank you so much for coming today. We're going to get started in just a few minutes, so please go ahead and grab some coffee and take your seats, and we'll get started in just a moment. Thank you. Good morning. Please, everybody, if you can, go ahead and take your seats. We are going to go ahead and get started. Thank you. Please also silence your cell phones, and we will go ahead and begin.
Welcome to Agenda for Change, Unite, Connect, Act. My name is David Lloyd, Senior Policy Advisor at the Kennedy Forum. We are very excited to bring together such a fantastic program of speakers and panelists. The initiatives, resources, and programs highlighted here today will be critical as we chart a path forward for improving access to mental health and addiction care in America. A few logistical notes before we get started. We encourage you to participate on social media. Use hashtag Agenda for Change and tag the Kennedy Forum to join the conversation. To view and download the materials discussed at today's event, particularly those materials highlighted during the upcoming panel discussion, text PROGRAM to 444-999 to receive a link to our website. That's PROGRAM to 444-999. This event is being streamed live on the Kennedy Forum YouTube page, where it will be permanently so you can watch it again later. Finally, we request that you avoid flash photography so as not to disturb our speakers. Now, it is my pleasure to invite to the stage our first speaker, Dr. Tracy Neal Walden, who will lead us in the Pledge of Allegiance. Dr. Neal Walden is a clinical director of the Easter SEALs of the District, Maryland, and Virginia. She is a licensed clinical psychologist and a retired Air Force colonel with more than 25 years of experience of mental health treatment, leadership, outreach, and policy. Welcome, Tracy.
Good morning, and thank you for the opportunity to be here. As stated, I'm Tracy Neal Walden. I'm the Senior Vice President and Director of the Stephen A. Cohen Military Family Clinic at Easter SEALs. At Easter SEALs, we're a nonprofit that serves veterans, regardless of discharge status, military family members, Guard, Reserve, and caregivers, providing evidence-based care in order to meet their needs. We strive to break down barriers to care by offering things such as extended hours. So we offer evening hours, weekend hours, as well as telehealth. And we vigorously look at our scheduling and templates in order to meet appropriate access to care standards. We see all of our clients within 2 weeks or less, and most within a few days for their mental health treatment. And one of the ways that helps us to do this is by offering telemental health. So we're one of the pioneers in this area, providing telemental health to the states of Virginia, Maryland, and the District of Columbia. Since opening our clinic, we're a young clinic, but since opening the clinic in the fall of 2017, we've seen over 900 veterans and military family members, and that number continues to grow. And we're very proud to do that and happy that we're able to do that. We're a proud partner of the Cohen Veterans Network, which is a network of 14 and growing clinics across the US that provides this service. However, 14 is a small amount, and as you all know, the need is vast. And so we need to continue to improve in order to provide evidence-based, quality mental health care quickly to all Americans. As an American and as a veteran, I'm proud to stand here and continue in this fight and on this front. And I look forward to our continued efforts. Would you all please stand and face the flag for the Pledge of Allegiance? I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Thank you. You may be seated. Thank you so much.
Thank you, Tracy. I'd now like to introduce former Congressman Patrick Kennedy, founder of the Kennedy Forum and Mental Health for Us co-chair. Congressman Kennedy was lead sponsor of the Paul Wellstone and Pete Domenici Mental Health Parity and Addiction Equity Act of 2008 and served on the President's Commission on Combating Drug Addiction and the Opioid Crisis. He is author, with Stephen Fried, of A Common Struggle, a personal journey through the past and future of mental illness and addiction. Welcome, Congressman Kennedy.
Thank you. Thank you, David Lloyd. And I know there's so many members of the Mental Health Alliance and organizations that are here today, and all of them, as you know, love working with David Lloyd. He is the most easygoing, down-to-earth, and smartest person when it comes to really staying connected to all of these issues and helping to translate them for all the rest of us, at least for me. I'm only speaking for myself. That's what I'm told to do in recovery. Just speak for yourself. Do not try to extrapolate your experiences to anyone else's but your own. But at first, thank you to Tracy, and thank you for your service to our country, and especially for our veterans. Too many of them come home in body, but not in mind. Too many of our veterans are caught behind the enemy lines of post-traumatic stress and traumatic brain injury and the shame and stigma of even seeking treatment. And you and the Cohen group are really working to be the 911 force. We have people in this audience who've served in uniform. You're the ones who are suiting up and kicking down the doors to help those veterans come home. And that is an incredibly noble thing, because in many respects, they're still on the battlefields. And I appreciate all the work that you do, and in neuroscience as well, which unfortunately, like so many of the other things we'll be talking about, we just have not done enough about brain research in this country. And so thank you for that. I appreciate the opportunity to be here in the historic Kennedy Caucus Room. This is the room that made history when President Kennedy announced his campaign for the presidency of the United States and the introduction of the new frontier. And as many of you know, we kicked off the Kennedy Forum on the 50th anniversary of JFK, particularly his signing of the Community Mental Health Act of 1963. And part of the new frontier that John F. Kennedy envisioned was embodied in that Community Mental Health Act and the Civil Rights Act that accompanied it. And when John F. Kennedy went on national television, he said, "Who amongst us would trade the color of their skin and be content with those who counsel patience and delay?" In other words, if you don't think this is a big deal for you, imagine what it's like for someone else, and what you would feel like if someone said, "Wait, now's not the time to do civil rights. Give it a few more years and we'll get around to it." Because that's exactly what we're doing with mental health today. We're saying we're waiting. We'll get around to that. We gave you $6 billion last budget. You should be happy. $6 billion is 1/4 of what we gave HIV/AIDS. And frankly, we're losing half as many lives as we're losing today to suicide and overdose. And we ought to be outraged. And I guarantee you 99% of Senator Smith's and my colleagues will probably go home and think it's a great deal that we got $6 billion. Because it's so much more than we had before, and we know everything is incremental. We can't be incremental about this fight. We have to be holistic in terms of the change. It's got to be across the board, a change in culture in our country in terms of how we address these issues. And the biggest challenge of all is the persistent feeling that we can't get our arms around this problem because it's too big. The exciting thing about what you'll see today is that we know Plan A. In other words, we don't need to bother you with all the details about prevention, treatment, recovery, early intervention, chronic disease management, reimbursement, bundle payments, value-based purchasing, technology, early sensing. You don't need to know all those things. All you need to know is we know what they are. And we know how to deploy not only the policies, but the programs. The only thing that's missing is the political will to do it. So, as you know, it's appropriate that we have these great words: unite, connect, act. We're not going to be effective if we're all doing this alone. And as you know, when I got to Washington, Gordon Smith, he heard from the Chamber of Commerce, and they came in. They said, Senator Smith, we're so happy you got elected. We got a Republican. Here's the Chamber of Commerce priorities. And he knew all of them. Every single committee in Congress, it didn't matter where he was assigned, he was able to do something for his constituents and his base. I get elected, liberal Democrat, the AFL-CIO comes in, said, here, Congressman Kennedy, are all your issues, from overtime pay to retirement to safe working conditions to trade to tax reform. Here it all is. And I'm like, okay. But when mental health is put before us, we somehow feel overwhelmed. We don't feel like we have the A to Z. But today, you're gonna be blessed. We have a guy named Paul Heller who's gonna speak in a little bit. Lost his son John to an overdose and mental illness, and instead of running away from the crisis, he's dedicated his life as one of the most senior executives of one of the most leading, and he said best, financial advisory firms, the Vanguard firm in this country, and he's getting all of his colleagues in finance around the country, who he's got entree to support an effort to revamp how we think about philanthropy and mental health. Give a great round of applause to Paul. And what a beautiful thing that we actually can get organized around social determinants, housing, education, all these things that impact trauma-informed care, all can be funded, but it can have a united way type approach. So we're organized. And that can dovetail with all of the great work that Wellbeing Trust has put together, along with the Kennedy Forum, for the digitized version of our initial members guide for mental health. You recall when we had the members guide, which is about every committee and what they could do, but that wasn't as helpful for the staff up here. And Tyler and Ben done a terrific job in translating that into a digitized version so that every staff person on the Hill can now download on their committee, the Justice Committee, the Health Committee, the Education Committee, the Defense Committee, every committee in this Congress can now know what issues are before them that can help this cause. And so I want to thank Wellbeing Trust. Give a great round of applause to Wellbeing Trust. And also I want to thank Angela Kimball for being here from NAMI, and John McPhee from the Jed Foundation, which my wife Amy is proud to serve on the board of, for the transition of kids from high school to college, where it's a very precarious time for young people. And my wife's a public school teacher, and she cares a great deal about social emotional learning. And and that's all I'll say about that. And until a few minutes from now. And of course, I love seeing Mary Gilberti here from Mental Health America, and formerly from NAMI, who's been working her whole life for this cause. And thank you so much, Mary. And to show you how God works in mysterious ways, I was at an event last night, and an old friend of my dad's walked in, and I'd heard from a friend that he had just lost his son, but he never told me. And I had talked to him, but he never told me how he lost his son. And so he was doing his thing. We were both working the room, and I could see him leaving, and I said, Bob, you've got to meet my friend Paul Gianfrido. He's president and CEO of Mental Health America. And Bob stopped, and he said, my son took his life on Christmas, and I'm devastated. He never said it to me. He said, and he went, and the first thing Paul Gianfrido said, how old was he? 43. You had 43 good years with him. That's what Paul Gianfrido, right off the top. And you could tell this was impacting Bob. And Bob said, well, my son was an adopted child, but we loved him like our own. And Paul Gianfrido's jaw dropped. He goes, I have an adopted child that lives on the streets of this country, even though I'm CEO of Mental Health America, because we don't have an adequate safety net for those with mental health illness. And in a nanosecond, the two of them were brothers. And that's the kind of spiritual connection that is going to carry us, because we can outline all the policies, but what it's going to take is a spiritual connection to say, enough is enough. This affects all of us. This stigma's got to stop. The stereotypes and marginalization of people with these illnesses and the embedded discrimination through the reimbursement of these services has to end, and we must enforce the Mental Health Parity and Addiction Equity Act. So I'm honored today to introduce Andy Slavitt here to talk more about the mental health parity. He was someone who knows a lot about healthcare as administrator of the largest health system in our country, the Centers for Medicare and Medicaid. You thought I was going to say like Blue Cross or United, or those folks don't have a scintilla. They can't even hold a candle to the amount of money that Andy ran through CMS. I have a long introduction to Andy, but I will tell you this, more than his brilliance, Wharton School, Harvard University, everything else in the world you can imagine, he's got heart. And what we need smart people with heart and with compassion, and it's my honor to introduce someone who's just like that, Andy Slavitt.
Thanks, Patrick. You know this. One of the most well-known rules of speaking, never follow a Kennedy. I've now done it twice in the same week. So here goes. And really thank you, Patrick, for all that you do to the Kennedy Forum, Mental Health for Us, for having me here. You know, for too long, our country sends so many people in this country the simple message that they just don't matter. Even worse, for too long we send the message to people with mental illness and in recovery, not only that they don't matter, but that there's something wrong with them. We send them this message by having only 25% of the mental health care professionals in this country that we need. We send them this message because insurance companies, by and large, don't do their jobs. If you need a mental health professional, you are 5 to 6 times more likely to have to go out of network than if you have a physical health need. That's if you're an adult. If you're a kid, you're 10 times more likely to have to go out of network to find a mental health professional. If you're in addiction treatment, you're 10 times more likely to have to go out of network. We send this message when we stigmatize MAT and cut it off. We send this message when we allow doctors to work on every organ and every part of your body, but tell them it's okay not to try to understand your brain. We send this message when we marginalize mental health professionals. 30 years without a raise in most parts of this country. We send this message when whole communities of people experiencing trauma, military communities, veteran communities, but also communities in poverty, also LGBTQ plus communities, are completely allowed to allow their trauma to go unchecked and untreated and uncared about. We send this message by putting more law enforcement officers in schools than we do counselors. It's true. All of these messages just zap people's self-esteem. They just zap it every single day. But they also do something else. They increase their risk of death. Suicide rates up 78% over the last decade. Suicide rates among preteens and teens up 300% over the last decade. We send people to earlier deaths when we do stigmatize MAT, when we cut Medicaid, when we stigmatize clean needles, when we don't require evidence, when we take away people's connectedness, when we condone bullying at every level of this country, mostly when we act. And by we, did you shut my mic off or did I shut my mic off? That was my sign, and then I got the mic shut off. That was pretty clever. But by we, who do I mean by we? Do I mean them? No, I mean we. I mean us. I mean you. I mean me. When you hesitate to seek treatment at the first sign of anxiety, ask yourself, would you do that if your child had asthma? Would you hesitate to seek treatment? Would you hesitate to seek help for a recommendation for a neighbor if it was a physical illness that they were going through instead of a mental illness? Would you let a hospital emergency room keep you for 4 hours, as they do routinely around the country, in a stock bed if you were having a heart attack? Would it be acceptable for an insurance company, for an insurance company to deny you an 11th visit for chemotherapy because they didn't think it was medically necessary? Or to tell you that there were just no oncologists in your network? Would that be okay? No, we tolerate that. We tolerate that because we too are plagued by stigma. And so what I've learned in working with Patrick and working with the Wellbeing Trust is that we can't do that. We can't do that. I'm part of an organization called United States of Care, which is blessed to work with Wellbeing Trust, blessed to work with the Kennedy Forum, and tell you that we have identified this year, while we think nothing's going to happen in politics, that one of the 4 greatest opportunities for states is advancing the health and well-being of Americans and enforcement of mental health parity. And we just put out a paper on that topic. I'm going to close with a 45-second story. Go for it? Okay, 45-second story about what this is like and what this reality is in going into states. I had a meeting, and I'm not going to tell you the person I was meeting with for a reason you'll soon see, and it was set up to be the very worst meeting you could possibly have. It was a Senate majority leader in a state, a Republican Party, deeply conservative, who got handed his briefing on who I was when I came in, and his first words were, "What the hell do you want?" His arms were crossed. He knew I was a former Obama official. He knew we had very little in common. And I could tell this was going to be a very short meeting, and I wanted to talk to him about some of the things that they could do in their state, particularly around Medicaid, and looking for a way in. And after 5 minutes, I talked about a bunch of things, including mental health, saw very little from him, and I stood up and I walked out. And as I was walking out, he said, "Hey, Andy, can you come back here for a second?" And I walked back into his office, and this story has almost everything in it because he was too embarrassed to have this conversation in front of anybody else. And in the hallway by his office, he looked down and told me that his brother had mental illness that was institutionalized. And he told me what a horror it was for his family. And I looked up, and this guy who had not had any time for me had tears in his eyes and was crying, and then told me he had never told anybody about his brother. He was that ashamed. But we started talking. We started talking about how many people were in that kind of situation. And I've never seen politics go away so quickly. So I think if we can get past that stigma, if he can say that in public, if he could talk about his brother, and he could vote like that, we're gonna make a lot of progress. And that's what I think all of us have to do, and we gotta start with us, and we gotta go from there. And now I've well gone over my 5 minutes. So thank you.
It's hard to believe he was the guy behind the scenes and not the elected official, the way Andy Slavitt just put that out there so eloquently and so passionately. Aren't we blessed to have someone as smart and capable as Andy Slavitt helping us? So I want to introduce our next guest, Carmen. As the data Andy highlighted about disparities in mental health access are rampant, I think just a few minutes ago, it's important that we look at what's going on in terms of the roadblocks across the country towards the children and their loved ones that Andy was also mentioning. Carmen can bring her own story and is very familiar with how much difficulty there is in addressing the continuity of care issues, provider network deficiencies, and really unlawful insurance practices that hinder recovery. Her story illustrates the profound impact that our separate and unequal system of care has on those who are trying to get care. Carmen, thank you so much for coming, and would you please come up?
February 9th, 2017. I walked up the stairs of our home calling my son's name, and there was no answer. I entered his bedroom, and I turned and soon found him. He had hung himself from his bathroom door. He was unconscious and not breathing. My husband called 911. His body was limp and heavy as I tried to get him off the door. My attempts at CPR were failing. EMTs arrived and quickly took over, and it was by far the longest day of my life. After the suicide attempt, my son regained his physical and cognitive abilities within a few months, but mental wellness would prove harder to sustain. We followed the standard in-network path of inpatient hospitalization to partial hospital programs to outpatient care. We were amazed that although there were really no answers for us, we were being quickly shuttled through the system. It didn't seem like a recipe for success. Sure enough, almost a year later, his condition began to deteriorate again. Eventually, we could no longer go to work. He was admitted to an in-network hospital with an available bed 5 hours from home. My husband and I immediately took action. At this point, we knew where this was headed. To continue down this rabbit hole meant we would almost certainly lose our son. It had been over a year since his suicide attempt, and although we had a long string of DSM symptom codes, we had no understanding of his underlying conditions, let alone how to treat them. We raided our savings account and began interviewing alternative programs. Upon discharge, he immediately enrolled in a therapeutic wilderness program, which was excluded by our health plan, but we felt we had no choice. Within a few weeks, his wilderness therapist had a better connection with him than anyone we'd ever worked with. Unlike inpatient care, which is 24/7 containment, wilderness provided 24/7 engagement. After 3 months in wilderness, we enrolled him at a therapeutic boarding school, also excluded by our plan. Thankfully, they were able to solidify his diagnosis and treatment needs, but ultimately, he still had to be transferred to a residential treatment center, one specializing in healing the effects of developmental trauma. Our path was longer and more costly than we could have ever imagined, but we finally landed in a place that felt right. Sadly, my own fight to secure coverage for his care was just beginning. Our small business employer has a self-funded plan administered by one of the big 5 insurance companies as a third-party administrator, a TPA. Although our son met the medical necessity criteria for residential treatment, Our plan repeatedly ignored the generally accepted standards of care and denied treatment. We presented extensive documentation, including records of his suicidal history, our failed attempts at lower levels of care, and the therapeutic boarding school's discharge documents citing escalating suicidal ideation and self-harm, culminating in a stated intent to kill himself again. Yet the TPA denial letter stated, and I quote, "There was no evidence that he was a credible risk for self-harm." Enraged, I launched into a battle with the TPA that would become nearly all-consuming. Errors and violations on our account accumulated. HIPAA violations, failure to process claims in time, refusal to disclose rate information, and more. I filed 12 written complaints and 4 appeals, several of which the TPA didn't seem to even read. I filed complaints with the state, the Department of Labor, NCQA, the employer, the broker, and others. I invested over 1,000 hours fighting for our benefits and submitted over 3,000 pages of documentation. Our employer, the broker, and even the Department of Labor advocated on our behalf. The plan was undoubtedly being administered illegally, but no one was holding them accountable. As a last resort, I sent a written complaint to the TPA's president. Only when their executive team realized I had meticulous documentation of their numerous violations, which I was willing to make public, did the plan reverse its medical necessity denial. I stand before you today with more hope than I've had since starting this journey. My son has made great progress in the programs that we found and now has hopes and goals for the future. Thanks to the Kennedy Forum. Thank you. Thanks to the Kennedy Forum and others in this room, we've managed to navigate the endless obstacles we've faced. We are incredibly lucky our son is alive and we've had a second chance, but many others do not. I implore the policymakers here today to take steps to change our broken system. Why are people being forced into a disjointed maze of mental health care to fend for themselves? Why are some of the most effective mental health treatments and programs excluded or relegated to out-of-network by most plans? Why is the onus on parents like us to call out major insurance companies? And ultimately, is my son less worthy of life-saving care than someone with cancer or diabetes? We hear the data. We know how many families are struggling with these same issues. Please do your part to right this wrong. There are many precious lives at stake. Thank you.
Thank you, Carmen. There's nothing that you can say that's more compelling than a parent's endless pursuit on behalf of their child. And it's humbling when you see that absolute, incessant effort to help a loved one that knows no boundaries. It's not going to stop at anything. And that's the kind of spirit that we as a country need to have for one another. That feeling that you have for your child and saving your child, our country should have for all of its kids that are suffering like your child has suffered. I want to say what an honor it is for me to be joined today by David Trone. Congressman Trone has been the champion in the freshman class, and he's proving the point that you don't need seniority to make a difference. He has literally managed to put together the biggest coalition of Republicans and Democrats together to address these crises, assembling bills all across the spectrum, using all of his philanthropic resources as a private citizen and as a member of Congress to help move this whole effort forward. And David, thank you for your great work. Congressman David Trone.
Good morning, everybody. I'll tell you, those stories like we heard from Carmen, I mean, what courage to go through that and to stick with it and just be such a strong advocate. And that's what a mom can do, but that's what all of us can do together, whether it's our own child or children that we know from neighbors and friends. We got to keep that personal face. And then people see that it's not just a number, because the numbers are so staggering. But the individual stories can get lost. It's an honor to be here today with Patrick, Senator Gordon Smith, Andy Slavitt, and Congressman Judy Chu. My mission in Congress is pretty straightforward. It's addiction, it's mental health, and it's criminal justice. Narrow. We're not trying to cook the ocean. Trying to work on things that can really make a difference for people that are not folks that have a lobbyist. These folks don't have PACs. These folks just have you. And they have their moms and their dads and their cousins and siblings. That's who they have. But we are powerful because we care so much. We care so much about the loved ones. And the ones that we didn't know, but we know they were loved by so many others, that we can and are going to continue to make an unbelievable difference. But it's our relentlessness in this room, it's our drive, our compassion that will change this. The numbers are out from 2018. In addiction, we lost 67,000 people. That's 184 people dead every day. Martin Luther King talks about the urgency of now. Well, 184 tomorrow morning, and then the next morning. That sounds a lot like now to me. So we've got to really drive and push to make that difference. Because the challenge is so important. And with that, we have mental health concurring, overlapping with addiction. 60-70% concurrence. But only 40% of those that have mental health are being helped. They're not getting, others are getting no assistance. I came about this mission through a personal connection. I have a nephew, his name was Ian, and he became addicted. And my wife and I spent a 5-year battle with him through rehabs, sober homes, jobs, inability to get places for housing, and then the mental health challenges, depression, anxiety, how that all tied in. And then, of course, the criminal justice piece, arrested 5 times. The navigating through that morass, and we had many great moments where we moved forward and we could see progress. But unfortunately, it's a disease we all know. It's a disease that grabs you and won't let you go. And he was pulled back in. And 3 years ago, he died of fentanyl, a fentanyl overdose, alone in a hotel room. But that wasn't his plan. He just liked to smoke marijuana. But when he was stoned, if someone offered him something different, he said, "I'll try it." So these type of stories resonate with all of us. But we've witnessed this firsthand. We've seen the difficulties and the complexities. So we need your help today. So we founded our freshman working group. We have 64 members, 31 states. we've put together 25 bipartisan bills, all about addiction and mental health. These bills we're working to move through Energy and Commerce, but we need you to continue to advocate with us. We need you to help us with ideas, because you're living in the front line. Those that live it every day and feel it and touch it, see the problems, see the obstacles. So we need your assistance. We need you to reach out to our offices and the other folks driving this, work through Congressman Kennedy's office and team, and we can work together, all of us. And we're going to really make a difference, because we're never going to quit until we get that 184 down and down and down, because we can absolutely do that. So thank you, and thank you so much for being here today.
I'd like you to pay attention to our screen. We want to show you what Dr. Raz is saying about U.S. for Care, U.S. capitalized. So obviously it's not just us, United States of Care, which we heard Andy Slavitt, but also mental health for us. And I had a number of people say, is it mental health for us or for U.S.? And I said, you got the right idea. It's that's what we're trying to get at, making that kind of double entendre. So if we have the Dr. Raz video, we can go ahead and play it.
Too many families are being ripped apart by overdoses and suicides. We can't afford to lose one more day, one more life to stigma and inaction. It's time for our policymakers to stand up for the millions of Americans impacted by mental health and addiction. That means prioritizing prevention strategies, making it easier for people to access quality, affordable care, and supporting those in recovery. It is time for mental health for us. Join the movement at mentalhealthforus.net.
That's a big deal. You know, you get people like Dr. Oz pushing the message out. That's what we need. We need that kind of, because Lord knows we've all seen each other's faces over and over again at all these events, and we need to open the door and welcome more people into the room and get more people involved, because it is about everybody. And that's how we're going to broaden the coalition. And speaking of coalitions, I was so honored when I served in Congress to get to know Senator Smith just a little bit when it came to his work with the Garrett Lee Smith Act, and the fact that it obviously had to get concurrent approval over in the House. And it was one of the real highlights of my time in Congress to have a senator come and ask me for help. I was like, oh, not that body. They don't need any help. They don't need any help, especially from the House. Anyway, but I will tell you, it felt so great, because I knew he was on such a personal and important mission that was going to change the country for prevention. And we all know, when we hear Andy Slavitt talk about the 300% increase in suicides between 10 and 14, something is wrong, fundamentally wrong in this country. And it happened to my next door neighbor. Amy and I have these retired folks that live next to us, and they lost their 13-year-old granddaughter to suicide. And that was just last year. On the 1-year anniversary, her father tried to take his life, was unsuccessful, and now permanently disabled for the rest of his life. The family is devastated, and it's one example of people we see every day when we go outside. To the point that David Trone said, these are all real human beings. And when Gordon Smith went on the floor of the United States Senate and talked about his own personal suffering, it brought out everyone else's suffering. And I know it happened to him like it happened to me before, late one night when I would go out on the floor and talk about a mental health issue, and I had one of the most senior members of the House of Representatives at the time, who never said a word to anyone about what had gone on in his life, say to me, "Patrick, thanks for what you're doing. My father shot himself when I was a child." And this was someone that no one in the House who wanted to get anything done didn't need to go through this one person. And he never said a word about it to anybody. But it was late at night, it was 10 o'clock, we were going for one of these all-nighters. You know, we're all sitting back on the couches in the cloakroom. The debate was on these issues. He saw me go in and he stopped me like that. And it's that kind of connection that changes the world. And Gordon sparked that connection so that even though he suffered the most profound loss any father can suffer, he ended turning that suffering into saving hundreds of thousands of lives. No doubt, through the Garrett Lee Smith Act, prevention has helped change that so other fathers and other mothers do not have to go through the unspeakable suffering that he had to go through. And that should humble all of us. What an incredible human being, someone I'm so proud has been with us from the beginning. Senator Gordon Smith, thank you for being here.
Good morning, ladies and gentlemen. Thank you for being here. I'm honored to join you. They gave me these wonderful remarks with all these statistics, but Andy already shared them with you, so I don't need to do that. I would like to speak in reference to some of them, but really more from my heart this morning. I feel like I've been riding on Kennedy coattails since I was an 8-year-old boy. My father worked on the White House staff of Dwight D. Eisenhower. I remember a morning on January the 20th, 1961, my mother woke me up and said, "Gordy, you're not going to school, get dressed warm. We're going to watch John F. Kennedy take his oath of office because your cousin, Stuart Udall, is the designated Secretary of the Interior." And so as an 8-year-old boy, I stood just off the Senate steps and saw the 34th President of the United States take his oath of office, and I caught Potomac fever. I was also thinking about how many Senate hearings I've attended in this room, and as I listened to these remarkable speakers, trying to imagine if any of those hearings involved a topic more worthy, more timely, more important than this one of mental health. And the answer is no. When my son took his life, my dear wife of now 44 years, and I had no idea the extent of his sufferings. He was a bipolar, and we got to it too late. And like so many moms and dads in this country who take care of their children's teeth and their eyes and their physicals and their feet, we don't sometimes take the time for early prevention to look into their brain and figure out how to help them with that. In our case, it was too late. But when we dealt with this sorrow, this grief turned into action for us, just like Carmen has shared. And working without any degree of partisanship, what I learned about mental health is that mental illness does not register Republican or Democratic. And so President Bush reached out to me, and Ted Kennedy reached out to me. We had a hearing in the Senate Health, Education, Labor, and Pensions Committee, and we put together a bill. My colleagues named it the Garrett Lee Smith Memorial Act. It passed the United States Senate 100 to nothing. But legislation was never made to be easy. And so when it went to the House of Representatives, there were a few Democrats, and I'm sad to say too many Republicans, who for one reason or another sought to block its passage in the House. But I found a champion. I called Patrick Kennedy, and I said, Patrick, we're not going to get this on suspension calendar, but we can get it through if you can hold on to your Democratic colleagues and vote for this despite the poison pill they've put in, because the next bill that will pass will take the poison pill out. He trusted me, and the House passed it with very few dissenting votes, huge bipartisan majorities, because again, it doesn't register Republican or Democrat. Just before President Bush signed this modest bill, a bill of $100 million that helps Indian tribes, states, colleges, and universities develop programs for suicide prevention. And it's still going on. It's a bill that broke the dam for mental health parity and VA assistance, and on and on and on. It broke the dam. Well, when I called Ted Kennedy, it was in the middle of the Bush-Kerry campaign for the presidency. And I was in Oregon campaigning for President Bush. And Patrick's father was in the Northeast campaigning for John Kerry. And I called him and I said, Ted, President Bush has invited you and me to be at the signing of the Garrett Lee Smith Memorial Act. I wish I'd have brought the picture of President Bush signing this bill, and behind me, with me, is my wife Sharon and my colleague Ted Kennedy. But when I called Ted, he said, where are you at, Gordon? I said, I'm in Oregon campaigning. He said, I think we're campaigning at cross purposes. And I told him about the invitation, and he said, I'm going to change my schedule and I'm going to be there because nothing's more important than this. And he was there. Ladies and gentlemen, when President Obama asked me to chair for 5 years the Action Alliance for Suicide Prevention, what I observed was a patchwork quilt blanket of noble men and women of different states, ethnicities, diversities, all working but unconnected in ways. And if any of your kids have a quilt blanket, you know that sometimes those patches have threads that let things fall through. And our job with mental health for us is to bring those patches together so no one falls through the threads. And so as you go forward working on prevention, as you look at ways to do early intervention screening, as you look at ways to reach out to marginalized communities of different ethnicities, American Indians, veterans, military service people, LGBTQ, include them. Help us to find additional resources. Help us to find more access through community health centers. Help us to make sure that it's affordable and available to all. And help us with recovery. There are so many people who, like in the case of our son, had we known earlier, I think he'd still be with us. Well, there are lots of facts and figures. Every one of them represents a boy or a girl, a daughter or a son, a husband or a wife. And there is behind each of those names, each of those statistics, a human and an economic tragedy. And I just want to encourage you by saying that when you work in the cause of mental health and suicide prevention, addiction recovery, you work on the side of angels. And so it is my privilege when Patrick called again and said, would you co-chair mental health for us? Despite my day job, I said, yes, I'll step up. I'll keep riding on Kennedy coattails. You know, the Udalls, who tend to be Mormons, and Kennedys, who tend to be Catholic, we actually have a lot in common. But beyond just an urgency and a vigor behind the principle of charity, we tend to be privately and functionally very pro-life. And when I say that, I mean we care about people, and we got lots of kids. My mother's name was Jessica Udall. Morris and Stuart Udall are my cousins. Mark and Tom Udall are my cousins. And if you want to know how bipartisan our family is, Mike Lee is my cousin too. So I'm somewhere in that continuum. But we have this addiction to public service and trying to make the world a better place. And the Udalls are sometimes called, we're honored to be called the Kennedys of the West. But we ride on Kennedy coattails. And thank you all for doing the same.
I'm going to introduce him. Judy Chu is here. I got to stick her in front. Well, the Kennedys are the Udalls of the Northeast. So I want to say when my dad and Gordon had that call, and Senator Smith talked about how they were working at cross purposes, what he didn't tell you is that my dad's response was, Senator Smith, I love you so much that I want to help you out any way I can. If it's more helpful for me to come in against you than for you, I'm happy to come in and campaign against you, if that'll get you reelected. So isn't it nice that that kind of collegiality, love, respect, compassion, sense of duty, and respect for our country, each other, the sense of unity that it was all about as I was growing up, was there at a time, and we can return to that time because we had it. And we can have it again as a nation if we put ourselves to the effort just in our own lives to make those small changes that collectively together that can change our country. I want to introduce Judy Chu as one of the people that's carried on Senator Gordon Smith's mantle on suicide prevention. Been one of the real champions in the House of Representatives on prevention, early intervention, as well as supportive housing, recovery-based supports, all the things that we know are the next generation of how we better treat those who have mental illness and addiction. Representative Judy Chu. Give her a great round of applause.
Well, thank you so much for that wonderful introduction. Thank you for having me here today. I am a clinical psychologist and also a member of the Ways and Means Committee and a member of its health subcommittee, which has jurisdiction over mental health. So I'm especially honored to be here at an event that focuses on the importance of mental health and addiction in Congress. Today's conversation is so necessary because we need to help everybody, both in Congress and in our communities. We need to get them to understand that mental health is just as essential for your well-being as physical health. And that conversation has to include addiction. As we devote resources to our mental health and addiction services, we need to be sure that we are treating the full spectrum of conditions. Often, government efforts focus on things like prevention and treatment, but neglect to focus on the follow-up and support recovery efforts as well. And so for those who take the truly difficult step of entering into treatment for their addiction, We need to be sure that they have appropriate support and care when they complete their treatment. And that care often takes place in the recovery residences known as sober living homes. Sober living homes are supposed to be safe environments where their addiction treatment can be even furthered as they put their lives together. But they are woefully underregulated, which means that bad actors have been allowed to flourish. And no one is immune, including in my own district. I will never forget the day when a constituent came into my office to tell me about his friend Tyler. My constituent was so heartbroken because Tyler had died in one of these sober living homes because there was no one on staff who even knew how to recognize the signs of an overdose. And you know that if you can, then you can use medications to reverse an addiction and an overdose. But there was no requirement in that sober living home that Tyler was living in that they needed to have the life-saving anti-overdose drug naloxone even on hand, let alone how to administer it. So Tyler's death was completely preventable, and so are so many others like his. That's why I pushed for language to be included in last Congress's major response to the opioid crisis, H.R. 6, that specifically created the first set of best practices for sober living homes. I was thrilled to see H.R. 6 signed into law with my language included. And so there will be best practices for these sober living homes. Yes. But our job is not yet done, and I'm excited to continue to work on this important issue with Congressmember David Trone from Maryland. I do have a special connection to this issue as one of only 2 psychologists in Congress. I know firsthand how critical it is for everyone, no matter their background or zip code, to have access to quality and appropriate mental health services. And that includes our senior population, whose mental health issues do not stop the day that they turn 65 and go to Medicare. So as a member of this Ways and Means Health Subcommittee, I introduced the bipartisan H.R. 884, the Medicare Mental Health Access Act. And that is to make sure that we do not have impediments to services from psychologists. In fact, it would allow seniors under Medicare to see a psychologist without getting a prior sign-off from a physician, which can be indeed that barrier which would delay service for that senior. So we hope that this can get passed and that we can have better access to mental health care for everybody. And then there are our children. I know that our children need timely mental health services, and that's why I introduced H.R. 2958 to establish a grant program to increase the number of mental health professionals at low-income schools by connecting institutions of higher education and local school districts. Professionals that participate in these partnerships would be eligible for student loan forgiveness after 5 years of employment as a mental health professional at a low-income school. And that is so critical because we need professionals at those schools to identify mental health issues early on so that our students can get the help and treatment that they need at early stages. And then there's the whole issue of the stigma of getting mental health treatment. And we know that there's far too much of a stigma, and it's especially true in certain communities. And I am certainly sensitive to this because that stigma is very present in the Asian American Pacific Islander community. Because there are pervasive stereotypes like the model minority myth and misunderstandings about mental health, AAPIs are actually the least likely to seek out mental health services. That's why I've introduced H.R. 2826, the Stop Mental Health Stigma in Our Communities Act, which promotes education and outreach in the AAPI community so that they know that they can access these services and have linguistically and culturally appropriate interventions. So thank you all for being here today. Thank you for your participation and advocacy. We must support policies that provide vulnerable populations with quality mental health and addiction care. And I commend you for all the work that you're doing. Thank you for being champions of mental health care.
Doesn't that make you feel good that Representative Chu is out there working? You're terrific, Representative. Thank you for all your great work. Thank you. And you'll have a lot of help in that work when the lady that just walked in joins you in Congress next year. That's all I'll say. That's all I'll say. We are on government property here, so we will leave it to that. I didn't mention anybody's name. But I turn your direction to the beautiful woman in the first row who just walked in. I just want to take this moment to introduce Dan Gillison, who's the new NAMI CEO. He's frankly, I think, only in that position for a couple of weeks, or is it a month or so? For all intents and purposes, we're going to declare this your first official act as CEO of NAMI, is to come to this thing. We're so grateful for all that you did at the APA Foundation. I remember working with you on that, and your background at the National Association of Counties. And for all of us, a lot of the criminal justice budgets are in our counties. And the most significant changes we can make in the mental health of this country is diverting people from what becomes the default mode for a lack of a mental health system, and that's our criminal justice system. And you did a lot of work on that issue when you were there at the National Association of Counties and also at the APA Foundation. NAMI made a great choice. Everyone in this room is looking forward to helping you in every way. We know how powerful and how much NAMI's on the front lines of these fights, and we're all in it together. And that's the great thing about today. Unite, connect, act. Welcome, Dan Gillison.
Congressman Kennedy and everyone here, you're right. I've been at the job for 2 weeks. So if you bear with me, I really greatly appreciate it. I'll start out by just saying that there's a quote. People don't care how much you know until they know how much you care. And for me to look out at this group and see all of the people that care and the difference that you make every day warms my heart. And for me to be in the role, to be able to spread the canvas, if you will, of work in justice and all the other elements and that whole ecosystem and supply chain of mental health and mental illness is an incredible opportunity. I'm very humbled by it. With that said, good morning. My name's Dan Gillison. As you've heard, I'm the new CEO of NAMI. For those who don't know us, and I'll be very brief, NAMI is the largest grassroots mental health organization in the nation, made up of over 600 state organizations and local affiliates. We're on the ground in communities across the country, providing education, support, advocacy, and raising awareness to improve the lives of those affected by mental illness. One of the many things that drew me to NAMI is how we represent the voice of all people affected by mental health conditions. That's in part because we listen and provide support. One area of our support is our free helpline, a nationwide peer support service which provides information, resource referrals, and support to people living with mental health conditions, their families and caregivers, mental health providers, and the public. Just last week, my first week, I toured the NAMI helpline and was moved by what I saw and heard. It's actually unimaginable, even hard to conceptualize for those who don't work in the mental health area what the level of need really is. The NAMI helpline is contacted over 30,000 times a year. Approximately 40% of the calls are from people living with mental health conditions, and the other 60% are from concerned family members, caregivers, and allies. We provide a vital service, acting as a compass to our callers to help them navigate a fragmented and complex mental health services delivery system. Like millions of other Americans, my family has also been affected by mental illness. In 1986, I lost my cousin Devorah to suicide. We were best friends and thick as thieves. Losing her has forever changed my life. And even though she will always be in my heart, her loss has profoundly impacted my life. Her memory, in part, drives my work to improve the possibility of recovery, wellness, and potential in all of us and everyone suffering with mental illness. My entire family was forever changed by this tragedy. But my family's not alone. Across the country, 1 in 5 adults experiences a mental illness which affects their families, their friends, and the communities in which they live and they would like to thrive in. It's our job as an organization and a coalition to elevate mental health issues and fight for change for all people impacted. The health of our nation includes mental health. It is imperative that people know where to find and access mental health care, when and where they need it in their communities. And what better way to change the minds of policymakers than to show them that right there in their own districts are stories just like my family's and many of yours. That is what is so special about the Mental Health for Us Coalition. We represent the leading groups coming together to shine a light on issues that matter to every American. Issues like prevention and early intervention, like equitable and affordable access to health care, like support for recovery and wellness that you spoke about earlier. These are all the things we believe in and that we fight for. Working together, we can amplify the voices and concerns of people living with mental illness and substance use disorders to drive change in the policies that shape our healthcare system so people can get on the path to living healthy, fulfilling lives, supported by a community that cares. And we must work together. It's critical to our shared success. The whole is greater than the sum of its parts. And by coming together, we can elevate mental health and addiction in the national policy conversations. When we work together, we can accomplish important initiatives such as advancing federal parity legislation and mental health reform. And it is those and other successes that inspire us to continue our fight together to improve the lives of everyone touched by mental illness and substance abuse disorders. Together, we are united for change. This is the foundation of mental health for us. We are a coalition of organizations from around the country dedicated to uniting the American people behind an effort to improve our mental health system for everyone. It is through this unity that we will find our true path to future success. On behalf of NAMI and the Mental Health for Us Coalition, we thank you for the opportunity to address you this morning.
Joe, it's your turn. Yeah.
Good morning, everyone. I want to start by thanking Patrick for asking me to chair this panel, and it's always a privilege to participate with him around his tireless advocacy and his leadership to move us towards uniting and connecting and acting around mental health and substance use care. I want to thank our panelists who are here today, and I couldn't think of a better way to start 2020 other than with this group of people and the work that they're doing to really move the needle on mental health and addiction care in this country. And I want to thank all of you who are here in the audience today, and also all those folks that are following us on YouTube today. And I want to remind folks that new Senate rules didn't allow us to pass out all the materials that the panelists will talk about today, so that if you text the word program to 444-999, you'll be able to access all the materials that are available there. I guess before we start, I want to make a comment or two. And I was really touched by that we started this meeting off with the Pledge of Allegiance. And as we were going through the pledge, as we end for justice for all, I'm reminded that we're all here because we deeply believe that we do not have justice for all. And that as advocates, that is what we're striving for, so that these meetings are about justice for all. And I also was reminded that of the relationship that Patrick has with Dr. Satcher, the nation's first Surgeon General to release a report on mental health care. And I'm reminded of their longstanding partnership and the fact that the Kennedy Satcher Center for Mental Health Equity exists at Morehouse College. And I guess what I would like to ask our panelists today, as they're thinking about their work, I'd like to really have them, deeply think about the issue of justice and equity for all. So if I could ask people to indulge that. So before we jump into this, so far we've heard this morning about systems failures in the midst of a mental health and addiction crisis in this country. And we've learned about mental health for us and efforts to unite the community and gain attention of policymakers. Now, this panel today will work on helping us to understand where we can connect and how we can act. And no more time than today is it important for the academic, the industry, and the public sector to unite to become action-oriented around the work that we face. So I'm going to jump in here, and today you're going to hear from philanthropy, the employer side, the research side, and the policy side. So I'd like to start here with an introduction of Ben Miller. Ben is the Chief Strategy Officer for the Wellbeing Trust. And the guide that the Wellbeing Trust just released last week, which is Healing the Nation in partnership with the Kennedy Forum. And I'd like to really speak to the fact that Ben and the work of the Wellbeing Trust is about looking at the mental, the social, and the spiritual health of our nation. And I think that to solve the problems that are faced, we have to think about it in that context. So Ben, can you comment?
Thanks so much, Joe. Good morning, everybody. I think we know now, based on today and hearing the stats and the stories, that inaction is unethical. We're at a place in our society where by simply knowing more isn't good enough. It's time to come to a place together where we do something profound. Our nation's hurting. We're in pain. So the solution to that is to heal. How do we heal? Well, we begin by conversations like today, but we don't just stop with that. We have to have a roadmap that takes us forward, something that brings us comprehensively together so that we have kind of an integrated and unique way to see mental health throughout healthcare. One of the cruelest ironies in healthcare that exists right now is that the more problems you have, or the more acute crises you're in, the harder you have to work. You go to healthcare for help, and yet it makes you work harder to get that help. There's something wrong with that. How do we make that easier? Two words that you hear as I talk through our policy work: seamless and integrated. What if our fundamental assumptions around mental health were flawed? That referrals were always our go-to mechanism for getting people help. What if that was wrong? What if we brought mental health to all the places that people needed it? What if that was our future? If we're going to heal, and I do have props, so forgive me, I can hold this up for the photo op here. Since we have two, I can hand out. We'll raffle these later. Healing the Nation is our attempt to really bring forward a more comprehensive and integrated approach to how we can look at mental health. It doesn't just say healthcare, here's your responsibility to integrate mental health into primary care. Things that we've known for 25 years work. It says criminal justice, our de facto mental health system now. How do we think about diverting people from going in there in the first place for care? How do we make sure that people that are incarcerated or get care? And then when people come out, how do we make sure that they have services wrapped around them so that they don't go back in? But the criminal justice system, addressing that alone is insufficient if we don't tie it to healthcare. And all of that is insufficient if we don't think about our workplaces, the places where we go every day, probably spend more time at work than you do with your family. Okay, why would we not think about having mental health and addiction addressed in that location? In our schools, which you've already heard about. The goal of this is twofold. One is to bring forward a framework that lays out policies that look at every point or opportunity for engaging a person around mental health in our communities and in our clinical settings. It's not sufficient just to look at one setting and say, we got that. We have to look at them and how they're connected because they are interconnected. People don't just live in one setting, they live in a community. That community is connected to a variety of different services. So in our guide, and you can see this at healingthenation.wellbeingtrust.org, you can go and download this. We created a mechanism so that members of Congress and the staff can look at those entry points. You can find criminal justice on there, and you can look at all the federal policies that need to be addressed for criminal justice. But the beauty of this is that while you're there, kind of like a website you might go to that recommends another book for you to read after you read another one, it says, hey, why don't you check out the school, the education system while you're here? And it brings us to a place where we have to make the connections between the systems. As Patrick said early on, there is no system of care. And if we're going to create something that really does not allow people to fall through the gaps in that beautiful quilt, we have to have a system of care. So Healing the Nation is a beginning to that. Okay, it's not the end, because that's why you're here. Simply putting out another guide, granted we had amazing feedback from many of you in this room, is not going to move us to action. What will move us to action is when each of you pick up something like this and you take it to your congressperson. When you take it home to your staff, your employees, and you begin to think about what are the policies that we're advocating for and how does that align with a much more comprehensive way to look at mental health. When we change that conversation within our organizations, within our communities, and I mean, heck, even at home, when you're talking with your families, it changes the culture of how we look at mental health. Without that, my friends, I'm afraid, and I love coming to this room, I love being around many of these people, I don't want to keep doing this for the rest of my life. I want to fix this. I know you want to fix this. Let's begin by healing, because inaction is unethical.
Thank you, Ben. Working in the field of philanthropy, I can tell you that it is very difficult often to identify the right point of action. We're fortunate today on our panel to have Kat Risqueta, the founding executive director for the Center of High Impact Philanthropy at the University of Pennsylvania, which is a partnership between the School of Social Policy and Practice and the Wharton School. Recently, Kat's team released Health in Mind, a guide to philanthropy and mental health. Kat, do you want to share with us?
Absolutely. I also have props. This is the guide that Joe's referring to. And quick poll, raise your hand if you made one charitable donation last year. Okay, this guide is for you. Because at the Center for High Impact Philanthropy, when we say high impact philanthropy, it's not about the amount you give. It's about whether you have $1 or $1 billion, that you're using that money in a way that can advance positive social change. That's what high impact philanthropy is for our team. Our mission is to provide knowledge and education so that donors around the world can do more good. You've heard a lot of statistics, and I think at one point in his opening remarks, Patrick said something that that really is the reason why we do our work, which is there are issues out there that affect all of us and can sometimes seem so big that we don't know how to act. We don't know what to do. There's a lot of noise. And the point of the guide is to cut through the noise so that everybody can feel more confident that you're making a difference. It really is unite, connect, act, It's to act. We couldn't have gotten here, by the way, if it weren't for the efforts of so many of you around the room. I know those of you gave us feedback, funded us. Patrick and the Kennedy Forum launched us over a year ago up in Hyannis. Thank you. And where we landed as a result of all of this work are 5 strategies that is very consistent with everything that you've heard today. First, a focus on young people to prevent and lessen the severity of the situations that you heard that nobody could articulate better than Carmen. The second is to support those with the most serious conditions, those who need appropriate care, often at a level of intensity and consistency and stability that we know is required to help them thrive, because when they thrive and their families thrive, all of our communities thrive. The third is to help those populations that are disproportionately affected, often because of poverty, geography, and discrimination. The fourth is, as Patrick said earlier, collectively, we know what works. Mental health conditions and addiction, this is not a new cause area. The problem is the knowledge about what works is siloed, and they're not being deployed by the people who are in a position to make sure that all of us have access to what works. And the last is to transform the landscape. We will probably always have conversations about how we can make this situation better. But with the right investments in transforming the landscape, it's not the same conversation. All right. So that's broadly how we see philanthropy can work. And I'm delighted to have a conversation with my fellow panelists about some of the details behind that. Thank you.
Thanks, Kat. So we've heard from Ben on a policy guide. We've heard from Kat on how do we work with philanthropists. And now I'm really excited to hear from Mike Thompson, who is the president and CEO of the National Alliance for Healthcare Purchasers Coalitions. And I'm excited about it because I think employers really represent an underutilized agent of change. Employers are out there buying health benefits, and often they don't know what they're buying. Not often. A majority of the time, they do not know what they're buying when we talk about mental health benefits. So I'm excited to have, Mike talk about the work they're doing and how to activate employers around the country to buy better, to create change. So, Mike.
Thanks, Joe. And I'm so thankful to be invited to this group. I really consider myself part of this community. I'm a past president of NAMI New York City. I believe very strongly in the NAMI organization. Obviously a family member and very much committed to this overall agenda. But I want to talk about employers and their role in this. And I separate it into two agendas, kind of the social change agenda and the system change agenda. And the social change agenda, I can tell you that even in the past 3.5 years that I've been in this role, they've moved it. They've moved it huge. When I came into this role, we did a survey, and all of the things that the coalitions were working on, mental health actually came up second to the bottom. Today, it's number 1. It is universal across every coalition across the country. Patrick spoke to our group 3 years ago. It helped to start the fire, and the fire is there. I don't think you can stop the momentum that is happening in employers today to change the culture around mental health in their workforce. It's employer by employer across the country, and I imagine where you work, you're seeing it through your own employers. So I think that's great. System change is a different story. System change is getting worse. The system is, we heard some of the issues that are happening, but the good news from my perspective is that employers are getting mobilized now. They are the biggest purchasers of healthcare in America, and they're not getting what they're paying for. They are very concerned about the lack of access for their employees and their families. We had a meeting a couple of weeks ago. One of the major employers said, you know, I only get complaints, nobody pats me on the back, and 90% of the complaints I get are in mental health. A second employer said, this is the issue that keeps me up at night. When my employees call me and they have their child, their daughter, their son is ill, potentially fatally so, and they're not convinced that their plan, which pays for mental health services, will support them in a timely manner. It's a problem. It's a major problem. So we have mobilized an initiative working collaboratively with the APA Foundation, the Meadows Mental Health Policy Institute, called the Path Forward for Mental Health and Substance Use, and it's focused on 5 key areas. Network access, collaborative care, which of course is integration of behavioral health into primary care, measurement-based care, creating accountability for disciplined treatment of mental health, parity, and of course telebehavioral health. And we know that the problems are not the same everywhere, but there's a lot of commonality across the country. What we have done as part of the Path Forward is we've identified 8 regions led by coalitions, employers, to engage stakeholders to measurably improve all 5 of those areas across the country. And we've selected those 8 areas specifically with an eye towards the diversity of our regions, whether it's California or Kansas, or New York City or Florida, or Texas or Minnesota, or Tennessee in a hotbed of the opioid crisis. So we are consciously moving this initiative forward. We've just getting started. It's a 5-year initiative. It is gearing towards measurable improvement. It's not a white paper, it's an action. So we're very excited to use the employer lever. I want to make one last comment, and I was mentioning this to Joe earlier. You say, well, isn't this a public health issue? We're engaging with public health. I mean, one of the themes here is connect, right? Unite. When we engage with public health, they are thrilled because it's their agenda too. And they're saying, you're kidding me, we got the employers behind us too? Yeah, we're all in this together. It's our system, it is our care, and we all need to improve it. So with that, I look forward to our conversation.
Thank you, Mike. Our final panelist brings us to the perspective of academic and research communities. Research is a critical part of the puzzle that needs to be solved. And Brandon Staglin, president of One Mind, and his family have grown to create a powerful brain health organization leading the way in brain health research. And One Mind is a lived experience-led organization. So, Brandon?
Thank you. Thank you. I'm Brandon Staglin, president of One Mind and a schizophrenia survivor. I stand for healing. I'm living proof that with loving family support, continued involvement in one's community to build a sense of agency and engagement, and science-based early medical care, one can recover from even the most scary, depressing, debilitating of psychiatric illnesses. Thank you. I'm happy to say that today I'm happily married, working at a job that I care deeply about, and my wife and I will celebrate our 11th anniversary in just 1 week, Valentine's Day. I'm grateful to be in the position as president of One Mind because now I can help inform the public about the great work that is being done in science that is essential to help more people recover from their serious psychiatric illnesses. Research in our country, despite the best efforts of nonprofits such as One Mind and the federal government, is dramatically underfunded in our country today. For example, the National Institute of Mental Health receives about $2 billion this year in funding from the federal government. That might sound like a lot of money. Consider the annual cost of brain disease in our country, something that Mike here helped to calculate in 2012. It's about $1 trillion annually due to healthcare costs, incarceration, lost productivity, all these factors move into it. And families are affected, not just the individuals with mental illness, which amounts to about, the individuals themselves are about 45 million people in the United States who are still struggling with treatments that are not good enough to help them. We need to invest more in research. So let me give you an example of why investment in research can be so effective, to give you such traction for your investment. A breakthrough occurred in mental health research in recent years. There's a new form of care for early serious psychiatric illness called coordinated specialty care. This was validated by a national study conducted by the National Institute of Mental Health and inspired by work that One Mind helped to inspire in the early 2000s. The study recently found that coordinated specialty care is much more effective than standard care at helping people with early psychotic illness to recover back to full and meaningful lives when delivered early. So, how is it so effective? It does things like what I was able to access by good fortune in my recovery. Helps young people by understanding what it is they care about in their lives. What do they want to achieve? What are their goals? Do they want to succeed in school again? Do they want to enjoy time with their friends again? Be connected to their family again? Get a job and succeed in that. And then builds on the strengths they have to give them the skills and the stability they need to succeed in their lives, get back on their feet and be productive citizens. With the recovery that is inherent, the potential for recovery that is inherent in coordinated specialty care and the wider deployment of it that could happen with more investment in research and care, I've calculated that given that schizophrenia costs the United States $156 billion annually, if the United States were to invest $1 billion more in coordinated specialty care research and deployment each year, it would save the country $320 billion over 20 years. It's unfortunate we have to talk in terms of economics when we talk about the suffering of human beings, but it's a number and we can grasp it. That's a huge number. Research needs more funding and will benefit people across the country immeasurably. I urge you, you have the power. Please support more funding for the National Institute of Mental Health and public-private partnerships to supercharge research across our nation. Thank you.
Thank you, Brandon. So I wish we could be here for 2 hours for question and answers, but we don't have that time. So I'm going to ask a question or two to the panel, and then we're going to put some mics out into the audience because we want to engage you all in that. But I'm reminded, a colleague of mine who runs a foundation out in Ohio, which is called the PEGS Foundation, had a founder, her name was Margaret, was known by Peg, and she challenged the foundation to always think bigger. Her expression was, think bigger. Is that a think big idea? So I want to ask you, when you ask your questions to this panel, think bigger. And hopefully that will scatter more good as we head into that. So what was that there? Okay. So I'm going to throw. I just got the sign that I've got to really condense this. So I'm going to ask one question to the panel, and I'm going to try to merge in a bunch of things. So I believe that we do not have a healthcare system in this country. I think we have a sick care system in this country. And, from your lens, as you think about a sick care system and how we make it a healthcare system, if you could comment on where you think the role of public-private partnerships are, whether they are emerging, existing, or to be developed, and if you could also think about this sense of how do we connect to each other, that we live in silos across this table. Historically, each one of us would have had a meeting to talk about the role of philanthropy, the role about policy, the role of research. So let me start with that really general question. So this is a chance to ask, that, and then I'll turn it over and we'll get 2 questions, hopefully, out of the audience. So, Brandon, you want to start?
Sure, thank you.
Think bigger and be succinct.
Will do. Okay. So public-private partnerships, as I mentioned at the end of my talk, are essential to developing advancements in care for our society. So I'll give you an example. So in California, I helped to pass a law called AB 1315, which allocates funding for early serious mental illness care. Now, it's meant to be a public-private partnership. It's becoming one. Now, I serve on the I advise the council that's deciding what to do with the $20 million the governor has fortunately just allocated to this. But the state wants to form partnerships with organizations like insurers, like healthcare companies, to also fund this care, bring in the private sector as well. And One Mind is working on the forefront of this with them. We've just launched a new program in Sonoma County, the neighboring county where I live in Napa, which is funded by a donation from Kaiser Permanente. They've been very generous to help us do this, and we hope to involve them even further in supporting this center and more centers around the state and hopefully the country soon in new ways. Thank you.
Thank you. Mike, do you want to we'll go down the row?
Yeah, 2 thoughts. One is kind of this public-private discussion. I don't think you solve it all with health policy, and I don't think you solve it all in the private sector. I think it's a combination. And I think we just need to recognize those, and they're mutually supportive. When we understand the issues that are getting in the way of solving, measurably improving people's lives, let's figure out how to solve those issues in both sides, both the private sector and in the public policy realm. In terms of kind of moving upstream and moving towards prevention, I think the front end of mental illness is well-being. It's a broader context. It has a lot of different dimensions. I know that's what the Well-Being Trust is totally focused on. And I think it speaks to, there's a lot of focus within organizations, employers, around well-being. We think the next generation is the engagement into the communities, that collaboration with the other resources in those communities to improve the well-being of those communities. And that's part of what we're going to foster within our coalitions. But getting it closer to mental illness, I don't think we're ever going to be in the mode of early intervention if we do not systematically integrate on a professionalized basis mental health into primary care. That is where people get their care today, and we need to make that a priority, and that's part of what the path forward is including.
What they said, plus 5. Here we go. Be bold in our vision, making mental health the #1 priority for every organization, public, private. 2, be consistent with our language. Language causes utter confusion because we don't always use the same words to describe the same things. 3, show up for each other. If you're at a meeting and you see the same old people, you're in the wrong meeting. 4, agree to do this one thing together. Whatever that one thing is, it can come from that meeting that you're with your new friends. 5, measure, evaluate, rinse, and repeat.
So given all the great comments my fellow panelists have said, I'm going to zero in specifically on the strategic role philanthropy can play. Right? If you think of the 3 sectors, you've got the business, commercial sector, you've got the public government sector. Those 2 sectors, in terms of sheer amount of resources, dwarf the philanthropic sector. Philanthropy is a drop in the ocean. But philanthropy can play a role that none of those 2 sectors can play. It's both the great part and the annoying part about philanthropy. It's not accountable to voters or to returning a profit. Which means when government funding is coming down in chutes and will only fund X amount because that's how the contract was built, but a real live person needs an extra 3 weeks to get to the outcomes that will really matter, that's where philanthropy can help. When there is a new technology or research that is just a little too scary to touch politically, and where you can't see, no business or investor can see a chance to get a return, funding that is where philanthropy can help. So what I would encourage us all to do with however amount of philanthropic funds we have is to think of those places where, because philanthropy can take risks and be more nimble, and where each of us don't have to ask permission or seek votes for anybody to deploy it, that's where you can contribute philanthropy to the broader goal of a system for health.
Thank you, Kat. So I see 2 hands up, so we'll take question 1 and question 2, and we'll see where we are after that.
Hi there. My name is Anita Burgos, and I work at the Bipartisan Policy Center. I really appreciate all the talk about integrated care. That's something that we're focusing on at the BPC. But putting on my neuroscientist hat, love research, and I love that that's something that was mentioned both by Patrick Kennedy and by the panel. So just in terms of research, what are some? Do any of you know some areas that would be sort of worth focusing on? It could be in the mental health policy space, sort of like looking at outcomes, or it could be more in the broader, neuroscience or brain research space.
Yes, thank you. Thank you for your question. I want to build on what Kat had been talking about, the need for investment not only by the federal government and other governments, but by philanthropy into early stage inquiries, to understand what it is that is at the basis of mental health conditions, and not just the fuzzy diagnoses that we see today. Cross-diagnostic research will be very important, meaning understanding what is really going on in people's brains. So One Mind has funded some programs that address this. For example, last year, One Mind gave a Rising Star Award to a young scientist at University of Michigan, now in Minnesota, who is looking at mental inflexibility, which is something that many of us experience in our lives. It's like you fixate on an idea and you can't let it go. So people with autism, for example, people with schizophrenia, people with depression, often fixate on, say, negative thoughts or things that just may be obsessive to them. And he's developing a treatment using neurostimulation, actual electric and magnetic fields administered to the brain in non-invasive ways, just via like a headset, that can ultimately help to correct that inflexibility and help people think and open up their minds to try new things and think in new ways. But that's one example of many. Neural circuits in the brain, the ways that nerve cells connect in the brain is a very big area of research today, and that's one example of the research that One Mind is supporting that area. Thank you.
Hi, I'm Skylar Johnson. I'm a student with Urban Health Media Project, and I'm also attending Richard Wright Public Charter School for Journalism and Media Arts. My question for you all is, how does an everyday young person like me make a difference in my community? Because I don't know if you all are aware, but I'm from Ward 8 in Southeast Washington, D.C., and it's not the greatest area, but I want to make a change.
Ben, if you could take the question.
So first of all, you need to be at this table right here. In all seriousness, the systems that we're making recommendations around, we're not building a system for us. And so if you're not at the table helping design the system for you, then we've made an egregious mistake. Because the next generation are who we fail when you're not at the table designing those strategies with us. So what can you do? Well, first of all, thank you for being here. It's a great place to start. Being a part of the conversation, making sure that every time you're in a room like this, you remind the folks that are of a different generation that you should be up here with us. I think that will turn heads and remind us.
Mike, do you want to jump on that real quick?
Yeah, I just wanted to say you're already making a difference. And the reason I'm saying that is we hear from the employers, it's the young people they are hiring that are demanding that they become much more progressive on mental health and substance use. So we congratulate you. Thank you.
This will be our last question from the audience. Concise.
Sure. My name's Mike Byer. I want to give you an optimistic note from 3 places that are on this table. We have a meeting with NAMI every year. We ask what people whose suicide didn't work out, thank God they got to live. We said, what drove you to your moment? They said family impairment and relationships. We asked veterans who go in for depression screening what's bothered them. They turn out to be self-medicating from PTSD and a night's sleep. And then we asked nurses at one of these hospitals to say, what's bothering you? They say, oh, it's anhedonia and tiredness, but underneath those causes, the root causes were OCD and PTSD. So my big idea to share with this room is look beyond depression. All these people, and lastly is with the Kennedy Forum, God bless Amy before she decided to run for Congress, inspired us to do a kids project at Morehouse School of Medicine where the data just came in. It was a dual site study, and none of the symptoms, again, that were bothering the kids were depression or straight general anxiety, social anxiety, OCD, and impairment. So I ask you to look beyond depression. Thank you.
Sounds great. Thank you. I just got the high sign that we've got a little bit more time. So can we get the microphone over here to the question that was being raised here? And then we'll go to the back corner, and then we'll,
Hi, I'm Carol McDade, and I'm here on behalf of the Parity Implementation Coalition. And I want to thank all of the panelists for all the contributions that they've made over the years. And Mike Thompson in particular, who represents employers, is an unsung hero for taking on this issue, and it might not have been popular with some of his own constituents. So thank you, Mike, for all the work you've done. Payers, to me, have a unique role in driving change in many of the areas, and this is public and private payers, in many of the common areas that you all have raised, whether it be about primary care, integration with mental health, whether it's parity, because they have the ability to incentivize providers to do these things through contracts. And similarly, employers, who are the biggest customers of payers, have the ability to draft contracts with them that might drive change. Why can any of the panelists who feel like it comment on why the leverage I think that payers hold and those that work with payers has not been fully utilized to drive the changes that many of us all agree on need to be made?
Thank you, Carol. Mike, do you want to grab that one?
Yeah, and it's a complex discussion, but I'll try to keep it simple. First, I honestly don't think the payers are the enemy in this. They're our allies. They truly do want to make this better. It's extraordinarily frustrating that it isn't getting better. The RAND study has indicated that the trend is in the opposite direction, continuing, and so that's not parity in practice, right? So we have a serious problem. I think part of the root cause issues there speak to the fact that none of these payers have significant market share in any given practice. And oftentimes, because of that, they don't invest in the change process that actually has to happen. They might have 10% market share, right? And are they going to take the time to work with every provider to put in a collaborative care model in primary care? Are they, frankly, I've often described the situation between the provider community and the payer community as a Cold War. If you talk to them, whose fault it is they're going like this, and frankly, we're caught in the middle, right? We Americans are being caught in the middle because we haven't solved this. And I think the fact that the APA has stepped forward and said, we're ready to talk, let's do it. I think the plans are ready too. I think the plans want to break through this Cold War. We did a study, and I'll just be very brief on this. We did a study looking at what the plans were doing, and we saw that they're not paying as well for mental health providers, even for the same codes as they are for medical providers. Well, how can you expect to get people in networks when you pay them less? I mean, that's just disrespectful. We actually went to the purchasers, the people who pay the bills, the employers pay the bills, and we said, we probably have to recommend to raise what we're paying them if we're going to even get them to the table to break the logjam. Is it okay to do that? And all of those employers said, we're already paying for it. We're paying for it out of network. We're paying for it in lost productivity. We're paying for it with people who are distracted because they can't get care for their children. We're paying. This isn't the system that we want. The system we want it to work. And so I think what we're looking for is to break that logjam and then really figure out what are those issues. The good news, right? We got new codes for collaborative care. The payers have turned those codes on.
Okay.
The problem is there's no claims coming through. So there's a change process that has to happen, and we need to facilitate that change process and figure out what those barriers are and then solve those barriers. This, Patrick said before, you don't need to know all the details. We know what works, but we have to get it done, and it's time now to get it done.
So we've almost run out of time, and I know there are several other questions. And what I will say is I know that this panel is more than happy to answer questions after Patrick wraps us up. But I do want to end on, I'd like each of the panelists to give one thing that they're optimistic about as we work to unite, connect, and act. So I'll start with you, Kat, and we'll come down this way, and then we'll hand it back over to Patrick.
You couldn't do the work that we do at the center without being optimistic in general about how much people care and how willing they are to help. My scientific poll at the beginning of my remarks, 80% of you are, in my mind, philanthropists. So now that this guide is out, this is more a call to action. You don't have an excuse anymore to act with impact. And the fact that so many of you are already acting, I hope this is just an accelerant. And that's what I'm excited about.
I'm optimistic by the young woman from Ward 8. Truly. I think that the next generation is going to demand something much greater than what they've been given in healthcare. And mental health is going to be so much a natural part of the fabric of their being. They're going to push us to do better. And so that gives me optimism.
I'm optimistic because in any change process, the first thing you need is readiness. And I would have said if we tried to tackle this as hard as we're tackling it now, we weren't ready even 3 years ago. But today, we have such a consensus across all the stakeholders, including the employer community. 86% say there's a problem with access. 86% say there's a problem with access. And I think they're totally unified, and they're going to do their part to support whatever across the entire initiative. Thank you.
Brandon?
I'm really excited that mental health is entering the zeitgeist, the media zeitgeist, building off what Ben was saying about new generation understanding the need to share about their mental health conditions and seek help when they need it, understanding each other when they experience mental health conditions, celebrities coming out talking about their conditions. This is raising mental health in the public discourse, and this enables people to not feel the stigma that they felt before and perhaps seek treatment, perhaps support research, and perhaps get the wellness that they deserve in their lives. So I'm really excited about that. One Mind has just launched its One Mind All Media program to help build a movement around this zeitgeist. We're eager to partner with people throughout the mental health community to make this a movement that will really make a difference. Let's unite, connect, and act. Thank you.
And I'm optimistic to work with individuals like you all and folks in the room. So before I turn it over back to Patrick, I just want to give everybody a quick reminder that if you want all the materials that are available here today, to text the word program to 444-999, and you'll be able to download all the resources. So I just want to thank everybody and think bigger and scatter good. So, Patrick. Thank you all.
My hope was that little machine that Brandon was describing, you could put around your head and it would break up negative thinking and, most importantly, narrow thinking and fixated thinking. I thought, boy, we could pass those around on Capitol Hill. It'd be really good for our country. It's good to laugh, and many of us are blessed today to also be able to laugh as much as we've cried. And so that's also the hope. And I thank all of you for sticking with us over so many years. There's so many people in this room who've been here from the very beginning, and I thank you for that. There's veterans in the audience. I want to thank them. I want to particularly shout out my good friend Paul Dillon, a Vietnam War veteran who's been our champion in Chicago year after year at the Kennedy Forum. Give a great round of applause. And is Rick Keller still here? Rick in the back. Therefore, so I always talk about, we always make mental health something like it's a negative, like it's just to help people who are in trouble, and we're all in trouble, and it's various degrees of trouble, and mental health is always put in such a negative light. And I always love telling the story how I had the honor of rededicating the Fort Bragg Special Warfare Center. And it was because it was called the John F. Kennedy Special Warfare Center that they invited me, not because of my good looks and personality. I showed up there, and they knew I cared about mental health, so they took me on this incredible tour where they showed me how the Green Berets train. And they said, Congressman Kennedy, do you know that the Green Berets get more mental health than any other branch of the service? And it totally boggled my mind because, again, we have these prejudices and these, fixed ways of thinking because I don't think about it that way. I said, well, how can Green Berets need mental health? They jump out of airplanes and they land in the water. They swim 5 miles without breathing. They come onto the beach and they're speaking 5 languages, and then they take out their target. They're reading to their kids by dinner time. These people don't need mental health. I know you know that's what I care about, but I'm already going to vote for this thing. In case you haven't noticed, it's called the Kennedy Warfare Center. You got me. It's like that old story, you had me from hello. And they said, no, seriously, Congressman. We don't look at mental health as something that when you take care of people when they are somehow in trouble. We look at mental health to allow all of our best and brightest to be even better. And I'm like, geez, And then so I'll leave you with this one thought, because Rick Keller is a Green Beret. And he said, in the Green Berets, we look at mental health as a force multiplier. And isn't that why we're all here today? We want to be the force multiplier for our kids, for those in the workplace, for those who are fighting addiction and mental illness, for our seniors. If we don't get the work done outlined by the experts on this panel, we won't achieve that force multiplication that we need to help everyone in America get better mental health. Thank you so much. Thanks for coming.
I think we all know